Hi guys, welcome back to ECA, to Student Paramedic. I'm Freyja and I work as a student paramedic in the ambulance service, and this is my video log of what I've been doing. So have anyone of you out there who is also interested in becoming an ECA or a paramedic in the future, I would like to talk to you about a subject matter which lots of people think we go to, but in actual fact we don't, and that's with blood. So I've been in the service, I suppose about 6 years now, and I've only been able to probably count on 1.5 hands the amount of time I've actually seen a quantity of blood, which I would think that's quite bad. Lots of people who are outside the service think that ambulances always go to lots and lots of blood. It's all very gory, very blood-like, and quite nasty. And to be honest, there is that as well, but not as much as I've seen personally. Other people might be a bit of a magnet, as they say, and go to that sort of job, but not for me. However, I've got two little beauties for you that I like to give my experience to. The first one was an elderly lady, way into her, I think she was in her 90s, late 90s almost. A fantastic patient, she was beautiful. And as you can tell, I love my patients. This patient fell very gently, very gracefully. However, because of her great age, her skin has got very, very thin. As you probably know, as you get older, your skin thins out. Instead of this sort of nice elasticy covering we have over our bodies, the skin actually thins out quite a lot. So when you get to an older age, it becomes to the point where it can tear easily and bruise easily and get damaged overall. But this poor patient, she had just fallen to the floor, and she had damaged her arm and her leg. When we went in, the lady had already had some kind of bandaging put onto it by a member of family, and unknowns to them, they used a dry bandage on a wet sticky wound. So consequently, when I unravelled the bandage to have a look at the wound on her arm, which is a lower arm, and also in her shin, it got stuck. So what I did was actually use water to soak the bandage and very, very gently and slowly peel off the bandage little bit by little, unravel it almost like a mummy's bandage it was, to reveal quite a significant skin tear on her lower arm. And basically what happened, that she had torn it and it had gone back and unrolled underneath itself. So you can see quite a large affected area, which was very, very painful when water was put onto it. So you can imagine that under your skin, on top of your skin, you've got your little nerve endings, but underneath that, now I can't remember my biology very well on this one, but the nerve endings are going to be very susceptible to any touching, any sort of movement, even blowing on an air on it. And so you can imagine water, tepid water, not cold, not hot, to clean the wound, get rid of any debris from the bandage, is going to be really painful. So this poor lady, she was in such a lot of pain, but she, obviously she was quite vocal with it, and we had to give her some analgesia to help her with that. Luckily, the wound wasn't free-flowing blood, it was quite contained. So I was able then to, after cleaning it up, putting dressing on there, giving it another bandage, and then called for an out of hours, or not an out of hours, what was it? It was a district nurse to come and redress the wound and have a look to see if they could help the patient any further. What I did was I had to try and bring back the skin, which had folded underneath, because if you don't try and bring it back, you can have quite a significant scar there. Now, I've been taught to very gently sort of ease it back, but not use anything more than a very gentle pull. And I used a wet gauze underneath just to sort of tease it through. And that way, when it does eventually close up, because it's then now away from any sort of infections and because it's cleaned, it would then try and heal itself as cleanly and as best as possible, really, with a minimal amount of scarring. And I think this is also what district nurses can do as well, but a lot better than me. But I actually really enjoyed doing that. Of course, I was under the supervision of my paramedic as well, and when I got to the point where thinking I can't really unfold it anymore, we just leave it. We don't actually try to force it back that way. And as I knew there was going to be a district nurse who was going to do the job anyway, I did the best of my ability, and then I thought, now we're going to leave it, then let the professionals, all the grown-ups, do it for me as well. As soon as that skin goes back onto the wound again and it gets covered up with the bandage dressing as well, the patient felt so much better, and it was almost like a night and day look. But then I had to address the problem with her shin. Now her shin had 3 quite large significant skinned hairs. I had to do the same thing with the shin, which took a good 20 minutes. You imagine 20 minutes of pain for this poor lady with analgesia as well. But with that one, I couldn't get the skin to cover so much. So what I did is I did my best, really, and then covered it with quite a few little sort of wet dressings, or a non-adhesive dressing I should say, would stick to the bandage. And as soon as that was then bandaged up, she felt miles better again. But cleaning it and obviously trying to deal with the patient's pain can be quite challenging. And if you're not sure how to do it, then always ask, you know, your colleague if they could do it. And if there's no way you can do it, if it's too far gone or there's too much dirt in there or something, always make sure that you've got a professional that can actually help you with that. Whether it be a district nurse coming out or a doctor coming out, or even take the person down to the ED and have it sorted then, because you know, at the end of the day it's the patient's best interests. However, for my patient, we were able to leave them at home and have it sorted at that point. So my learning from that was using a wet gauze to sort of help tease that skin over the wound, and also what sort of analgesia I could use for my patient. And this lady, we offered her Entonox and things like that, and in the end she just wanted paracetamol, which probably did something for her pain, but I think I'd rather have a bit stronger than that. My other patient was quite a serious patient. It was a trauma. Again, I won't go into details of where it was or who it was, but I will say is that it was a head trauma by persons unknown, and when we got to this patient, they were GCS 3 from what I understand. So if you have a look at the Glasgow Coma Scale, you'll see that how poorly this person was. As soon as we saw the person on the floor, HEMS came out, which is the helicopter paramedics, the specialist paramedics, and the people who have got more skills than we have as regular paramedics and students. We got to the patient and I saw there's a lot of blood on the floor. So much so that it was very difficult not to stand in it when you're actually dealing with the patient. And the first things that my paramedic did was check the wound in the head, which was quite significant. And if you remember your training, the category, the first things we looked for, besides scene safety and situation, which is what we had to do because of persons unknown could have been still in the area, checking for CAT-HEM is the first thing we had to check for. And of course this one was quite significant, so we had to stop that first before then moving on to our ABCs. Luckily we had a lot of backup quite quickly. We were able to get the clothes off the patient, do a top-to-toe assessment for anything else, any other injuries they may sustain that we can't see. Sadly, when people are attacked, other things that could happen to them is covered by clothing. And one of the things I was taught very, very early on is when you do a top to toe and you want to check to see if there's any other injuries that even they may not know about, check under the armpits as well, because some people can be quite nasty and do a lot of damage with coat hangers deliberately, so people can't find the injury site. But luckily for our patient, that the head injury was the only thing that they had going on there, and that was dealt swiftly, covered up. When the HEMS came, there was TXA given, so transexamic, I think it's pronounced, acid, which helps clotting, but that is something I cannot give as a student. Only a paramedic can give that. So our patient then was scooped up onto the stretcher and taken to resus quite quickly, and from what I understand, he is doing well. When you have a situation like that, you might find you'll be stepping in bodily fluids of different sort of calibre. Obviously make sure that afterwards you clean everything down. If you need to, you have to get rid of it, you have to get rid of it. You have to clean it off as effectively as you can, and if you can't get rid of it, then you might have to remove it, bag it and send it back to the station, or get rid of it and ask for a brand new uniform or brand new pair of shoes, which is what happened to me. But that's my 2 patients for you today. On my next video, check it out, because I'm going to be talking about 2 people who are part of the service and who have side jobs, which are going to be very, very interesting for some of you, all to do with fitness. Take care, stay well, and I'll see you next time. Bye bye for now.